Hello everyone, welcome to Online Educator. Today we'll be posting a video about some basics, terms or terminology that is used commonly in anatomy. So we are going to be posting a video about the anatomical terminology. So let us get started. Anatomy is a descriptive science and requires names for many structures and processes of the body. And as these terms are mostly derived from Latin and Greek, languages which are not used in everyday conversation, pretty most you can observe that these words are not going to change and are not changing now. Anatomists and healthcare providers use this terminology in order to increase precision and reduce medical errors. It brings all the anatomists, healthcare professionals onto one page about when discussing a patient or a topic. For example, a scar which is above and is located on the forearm 2 or 3 inches away from the hand, or when you're discussing or when you're describing a scar, you say that a scar is located at the base of the hand. Is it on the palm side or the other side? So it becomes very confusing for the other person to understand. Instead, you can refer to it as the scar located in the anterior carpal region. It makes more specific, and anybody can easily know that yes, anterior means the palm side, carpal is the wrist region, so we get to know exactly where it might be. Okay, then these terms are made up of the roots, prefixes and suffixes. The root of the term refers to an organ, tissue or condition, whereas the prefix or suffix often describes the root. For example, the most common disorder that we know about is the hypertension. The prefix in this word is the hypo, which means high or above the limit, and the root word is tension, which refers to the pressure. The word hypertension refers to abnormally high blood pressure. Then we have hypotension, which will same, tension means pressure and hypo means low or below the limit, so low blood pressure. Okay, then in these anatomical words, not all words are going to be, there are some words which are made depending upon the structure's shape, such as the deltoid, size of the muscle, biceps, location, temporal muscle in the temporal area of function, such as levator scapula. Scapula is a bone, levator means to elevate, so a muscle that elevates the bone, levator scapula, or resemblance of one structure to another. Now, in these terminologies, we have some names which are known as the eponyms. Now, these names are given by the scientist or the person, the original person who describes the structure or assigns its function, such as the sternal angle is also known as angle of Lewis. It was named by a person named as Lewis, so it was named on him. Now, these terminologies give no clue about the type or location of the muscle or structures or anything. Neither do they give any information about the function. They just give an idea about maybe it was named upon the person who invented it. Then we have something that is known as the anatomical position. To further increase the precision, anatomists standardize the way in which they view the body. Now, this standardized way of body or the standard body map is known as the anatomical position. As shown in the figure, the anatomical position refers to the body position as if the person was standing upright with the head, gaze or eyes and toes directed anteriorly or forwards, arms adjacent to the sides with the palms facing anteriorly and lower limbs close together with feet parallel. And the same, you get an anterior view of the body and you can see a posterior view in the body of the body. Now, whenever we are looking at a particular condition or describing something, we must always keep in mind this anatomical position. For example, if we want to say a scar located, as I said in the video earlier, a scar located in the anterior is always going to be the palm, carpal region. So it is always present on the palm side. Anterior is the palm side. Even if you keep the hands or palms on a table, the anterior surface is still going to be the palm side. Then we have the anatomical planes. Now these planes are derived in order for the clinicians to view the virtual sections of the body. We usually have it mostly used in the sections or the lab part, the radiologist part, where we have these x-rays and MRIs done. So it is mostly used, but in order for us to understand, we need to know what the planes are. So a plane is an imaginary two-dimensional line or a surface that passes through the body. Now there are three main commonly used planes which are used in anatomy and medicine. In the slideshow I've mentioned 4, but as we learn we'll get to know the first and the second as same. Okay, so coming to the medial plane or the sagittal plane. The sagittal plane divides the body or an organ into vertically right and left parts. It goes right through the middle of the body. If it goes through right in the middle of the body, it is known as the mid-sagittal or median plane. If it divides into unequal sections of left and right, then it is known as parasagittal plane. Then we have the frontal or coronal plane. It is a plane that divides into the body into front, that is the anterior portion, and a posterior rear portion. The frontal plane is also known as the coronal plane. Coronal plane is derived from the word corona, which is in Latin, which means crown. Transverse plane, also known as the horizontal plane, it divides the body horizontally into upper and lower portions, and it produces images which are referred to as cross sections. Now whenever we are discussing a particular plane, we need to have a reference point. For example, a transverse plane through the umbilicus. It need not be a body structure, it could also be a visible or palpable landmark or vertebral level. Then we have the anatomical sections. As I told you that these are mainly used in the radiologist in order for clinicians to create in imaging techniques such as a CT scan or an MRI scan in order to describe and display the internal structures, which are three most commonly used planes are longitudinal, transverse sections or cross sections, and oblique sections. So that's it. We'll catch you up in the next video. Don't forget to like, comment, share, and press subscribe. Do let me know in the comment section below what topic do you want the video to be posted, and we'll get it done. Thanks a lot, and don't forget to share because sharing is caring.